Hi, my name is Maria Esther Montero Moreno, and I'm gonna read the chapter 5 of the Professional English in Use book. Chapter 5, Medical Practitioners. 1. A. Practitioners. In Britain, doctors, also known as medical practitioners, must be qualified, have a university degree in medicine. They must also be registered, included in the General Medical Council's list or register. In order to practice, a doctor who treats patients as opposed to one who only does research is called a clinician. A doctor who provides primary care for patients is known as a general practitioner or GP or family doctor. GPs usually work in a group practice. Larger group practices work in a building called a health center. B. Specialties. Specialist doctors, for example, pediatricians, generally work in hospitals. However, those who work outside the NHS, providing private healthcare, may have consulting rooms outside a hospital. For example, in the famous Harley Street in London, the two main branches of medicine are surgery and internal medicine. And the doctors who practice these branches are called surgeons and physicians. Expectedly, in Britain, male surgeons are addressed as Mr. and females as Mrs. So Dr. Smith is a physician and Mrs. Smith is a surgeon. A cardiologist specializes in diseases of the heart and circulation, or cardiology. A geriatrician is a specialist in diseases of elderly patients or geriatrics. And anesthetics specialize in anesthetics. C. Choosing a specialty. Jill Matthews has just graduated from medical school and is talking about her future. I haven't decided what to specialize in yet. I need more experience before I decide. But I'm quite attracted to the idea of pediatrics because I like working with children. I certainly prefer to work with children than, say, elderly patients, so I don't fancy geriatrics. I was never very interested in detailed anatomy, so the surgical specialties like neurosurgery don't really appeal. You have to be good with your hands, which I don't think is a problem for me. I assisted at operations several times, and I've been done some minor odds by myself. But surgeons have to be able to do the same thing again and again without getting bored, like tying off closed arteries and so on. I don't think that would be a problem for me, but they need to make decisions fast, and I'm not too good at that. I like to have time to think, which means surgery is probably not right for me. Exercises. Exercise 5.1. Write sentences to describe the work of the specialties in each branch of medicine. Look at B opposite to help you. 1. Dermatology. A dermatologist specializes in diseases of the skin. 2. Rheumatology. A rheumatologist specializes in musculoskeletal and autoimmune diseases. And 3. A traumatologist Dermatology. A dermatologist specializes in diseases of the locomotor system. 4. Pediatrics. A pediatrician specializes in children's diseases. 5. Obstetrics. An obstetrician specializes in caring for women during pregnancy. Exercise 5.2. Complete a table with words from A, B, and C opposite and related forms. Put a stress mark in front of the stress syllable in each word. The first one has been done for you. Specialist, specialty. Practice, specialize, specialist, specialty. Practice, practitioner, practice. Consult, consultant, consultation. Assist, assistant, assistance. Graduate, graduate, graduation. Qualify, qualification. 5.3. Find prepositions in C opposite that can be used to make word combinations with the words in the box. Then use the correct forms of the words to complete the sentences. Good interest specialized work. 1. A pathologist specializes in diagnosing disease through examining cells and tissue. A pediatrician must enjoy working with children. 3. An oncologist is interested in the diagnosis and treatment of cancer. 4. A psychiatrist must be good at counseling. 5. A neurosurgeon must be good with her hands. Exercise 5.4. Make word combinations using a word from each post. 2 words can be used twice. Look at A, B, and C opposite to help you. Consulting rooms, general practice, general practitioner. Group practice, health center. Internal medicine, surgical specialties.